Okay, good afternoon, folks. Why don't we get started? And we have the recording starting as well. Welcome to today's webinar, Mental Health in the Workplace, Stigma-Free Solutions for Employees and Employers. I'm Mary Nasenbenny, and I head up the Workers' Compensation and Group Benefits Claims Organization for the Hartford, which is the host for today's event. Our format will be pretty simple. We'll have an overview of mental health conditions and then a panel discussion with our experts. I'm really privileged today to moderate the discussion with our new partner, the National Alliance on Mental Illness, also known as NAMI. NAMI is the nation's largest grassroots mental health organization dedicated to supporting millions of Americans affected by mental illness. Let me share a little bit about our three panelists. First, we are thrilled to have NAMI's Chief Medical Officer with us, Dr. Ken Duckworth. Dr. Duckworth is based in Boston, and along with his work at NAMI, he also works to improve care at Blue Cross Blue Shield of Massachusetts. He volunteers and consults at an early psychosis clinic in the Massachusetts Mental Health Center, and he teaches as an assistant professor at Hartford University Medical School. Welcome, Ken.
Thank you. It's great to be here.
Today's discussion will also include Kristen Brown of JetBlue. I'm sure you're all familiar with JetBlue, New York's hometown airline and a leading carrier in Boston, Fort Lauderdale, Hollywood, Los Angeles, Orlando, and San Juan. JetBlue is also a Hartford Group Benefits customer. Kristen, who hails from Long Island City, New York, has been with JetBlue since 2004 and is JetBlue's Director of Benefits. Kristen combines her passion for great service with her background in benefits to build innovative plan designs and solutions and drives JetBlue's company-wide benefit strategy, both domestically and internationally. Thanks so much for joining us today, Kristen. Finally, today's panel also includes my colleague at Hartford, Adele Spallone. Adele heads up a large team of clinicians, 350 strong, within our Workers' Compensation and Group Benefits Claims Organization. Based in South Florida, Adele also has more than 21 years of experience in the industry, and she's licensed as a mental health counselor and a marriage and family therapist. Adele, thank you for joining us today.
Excited to be here. Thank you.
So with this terrific panel, we're going to discuss an issue that's been top of mind for many business leaders, and that's mental health in the workplace. Of course, certainly with the COVID-19 pandemic, it's exacerbated the mental health challenges that we are facing in the workplace and making it an issue that can't be ignored. We thought a good jumping off point for today's conversation is the research recently conducted in the mental health space in the workplace. The Hartford's 2020 Future of Benefits study was an online survey of 760 employers and 1,500 employees fielded in two waves, early March and mid-June. The results were fascinating, and let me cite a few of the key findings. First, a majority of employers, 59%, indicated that mental health conditions, including anxiety and depression, are a significant workplace issue for their organizations. 68% of employers believed that they foster an open and inclusive work environment that encourages a dialogue about mental health. But interesting, less than half, only 42% of U.S. workers perceived the work environment to be that way. Only 44% of working adults feel that they have flexibility in their schedule to get the mental health treatment they need, although 71% of employers believe that they're offering such flexibility. If you would like to see some additional information, including our press release and infographic on the study, it's hosted in our newsroom on thehartford.com. Our goal today is to discuss solutions to bridge the mental health divide between employers and employees and provide tips to help foster stigma-free cultures. After our panel discussion, we'll get engaged in Q&A if we have time, so please feel free to use the chat function to submit questions along the way. Before we get into our discussion, I'd love to ask Dr. Duckworth to tell us a little bit about NAMI and provide an overview of mental health conditions. Dr. Duckworth? Dr. Duckworth, are you there? If we lost him. I think we may have lost Ken. Well, while he works to jump back on, let me turn our attention to a couple of comments in relation to our panelists. First, Adele, I mentioned that you run a team of 350 clinicians, some apparently focused in mental health. Could you tell us a little bit about your team and the connection with mental health?
Yes, absolutely, Mary. So included in the group of clinicians that we have at the Hartford, we have a behavioral health unit that's comprised of almost 50 licensed master's level clinicians. And that includes licensed social workers and licensed mental health counselors who have an extensive range of mental health expertise. And this group provides intensive case management for employees that file psychological disability claims because of the challenges that we see that arise when employees go out of work due to a mental health condition. Our clinicians will actually call and have direct contact with the employee so we can really try and understand and assess the treatment, the drivers, the obstacles, and the challenges that are preventing an employee from working. You know, we see employees file many types of claims. Some it's because of a primary condition like depression, stress, or anxiety, and they're feeling incapable of functioning in multiple settings, including work. And then we also see employees that file claims due to physical injuries and illnesses. They have a concurrent psychiatric component or comorbidity that's also seen because people experience a change in their health status when they're sick. They might be adjusting to new medications. They might have to deal with functional impairments, restrictions, and limitations to their normal activities of daily living with direct implications to their mental health. And research has actually shown, Mary, that the quality of one's life dramatically decreases when one is unemployed or placed on a disability. So it really becomes essential for the professionals involved in the disability management process to have empathy, compassion, and the skills and training to look at an individual holistically and incorporate biological, psychological, and social factors present when one is disabled. So at the Hartford, as we can see with all these clinicians, we've made a significant investment because of the complexities with mental health, the challenges that we see individuals have with treatment and treatment compliance, and the importance of working with treating physicians to ensure an employee's safe and healthy return to work. And at the core, we fundamentally believe that majority of psychiatric diagnoses are not permanent. And in fact, the inability to function in multiple settings, including work, can be temporary as these conditions are addressed timely and effectively managed.
Great. Thanks so much, Adele. Let's go to Kristen. I think we have Dr. Duckworth back on. So
yeah, I'm correct, Mary. Sorry about that brief internet moment.
I know, it's our life these days. Kristen, we understand you launched a Healthy Rewards program as well as JetBlue's signature blue carpet model for concierge advocacy, clinical, and financial wellness. We'd love to hear more about your work in that area.
Yeah, happy to share, Mary. Thank you for the opportunity. So several years ago, we launched something we like to brand Blue Carpet. Think of it as that red carpet moment, right? Everyone makes you feel special. The lights are on. You're dressed to your best. Couldn't we bring that to the wellness or the healthcare space? And our initial impression was to focus on physical health first. So we did it as a high-touch concierge approach for clinical and advocacy to physical health. And because we're JetBlue, of course, we named it Blue Carpet. As time has gone on, we've really looked at our wellness strategy and thought, how could we evolve even further into this space? Just as our external brand, if you will, or campaigns, if you've flown with us, we've got a pretty funny one out there that says, just all right doesn't fly here. The staying stagnant with your strategy doesn't work for our crew members, which is our word for employees here at JetBlue. So as we've looked at the past 2 years, we've looked at JetBlue as wellness being a holistic investment of support for the full scope of a lifestyle. It needs to encompass the physical, the financial, and the mental health, not a singular emphasis. Research has shown that these issues are intertwined. People with financial issues are more likely to have emotional stress. Individuals with financial and physical health concerns are more likely to be absent or less present when they are there. So we've thoughtfully curated our approach to tailor to our crew members' individual needs within the spectrum of support versus kind of a one-size-fits-all mentality, regardless of style or delivery. I sometimes think of it like street traffic lights, right? Green, yellow, red. If I think of the spectrum or continuum of care in the mental health space, we spend a lot of our time as employers focused on the red, the chronic conditions, the 3% of your population that's driving 25% of your spend. What if we developed just as much effort and time into green light, the preventive care, the EAPs, the mental health, the mindfulness, as much as those who are right in the middle, the yellow lights, those who are actively seeking care, that we still have the ability to bring them back to that green light, if you will. And with some of those differentiators, as well as definitely incorporating the viewpoint of what's relevant to our crew members, it definitely influenced our approach versus just going with a corporate edict, if you will, from on high. We gather those voices through speak up engagement surveys, unions, and just individual crew members who have a personal passion on the topic of wellness, and especially mental wellness. That JetBlue voice of the crew member, it resonates in shaping how we approach the well-being of their families. Our crew members definitely, they cover the spectrum nowadays as well, baby boomers to Generation Z. So we also have to think about the modalities and the delivery of service that we provide that is thoughtful for that. Even pre-COVID, JetBlue being transportation, we were not a traditional brick and mortar setting as an employer. So how could we bring wellness or mental health care to you in the fashion that brings you the most comfort at the time that you're ready to engage and embrace it? So our strategy is really built on the premise that we empower our crew members to be accountable for their health, to solve for our population health risk, as much as enable them to be emotionally balanced and financially secure. And in turn, we at JetBlue provide them with a connected, holistic experience that demonstrates value and better outcomes, optimal cost, and just increased balance of their lives.
Wonderful. Thank you, Kristen. Mm-hmm. Dr. Duckworth, if we can turn to you, I'm sure that's music to your ears as you hear about these programs.
Well, culture is an important piece of the portfolio of addressing wellness.
Yeah.
Culture is not the only thing. You know, what the alternatives are, what the benefit structure is, are also extremely important. But the culture, I think, it is where it all begins.
Yeah. So, Dr. Duckworth, could you tell us a little bit about NAMI, as well as mental health conditions, sort of generally, to set the table for the remainder of our discussion?
Sure. The National Alliance on Mental Illness is the largest grassroots organization of people who live with mental health conditions and those who love them. And if any of you have heard of the mental health parity legislation, where insurers were mandated to cover mental health and addiction services the same as medical or surgical services, that's an example of the kind of work NAMI does. Across the country, there are free educational programs for families and individuals who live with mental health conditions. There's 630 affiliates across America. It's a remarkable group. And it grew out of parents who felt that the system should be doing better for their children. And that root remains. If you look at mental health during COVID, Anxiety disorders are number one by far. Anxiety is wired into us to anticipate threat. And while this is not a mastodon, this is a microscopic viral collection of proteins inside of a little tiny, tiny suitcase that is just ready to infect people. Your sense of uncertainty and the unknown is activated. And so anxiety disorders are number one in terms of what people are reporting. Depression is right there. People are experiencing loss, distorted kinds of grief. People are isolated. Connections with other people is incredibly protective against depression. And people are experiencing more relapse for people who had been in recovery. So the good news is more people are seeking help. The mental health field has pivoted pretty nicely to providing services, just like we're having this conversation, through computers. But I don't think that works for everyone, and not every service is optimally delivered through that vehicle.
Thank you. I guess to kick off the discussion then, let's turn to the Hartford's research. And I just mentioned that a key finding is that divide between what the employers are attempting to deliver and the way the employees are feeling. Does that surprise you, Dr. Duckworth, that there is that disconnect there?
I think the American phenomenon of having your health care through your employment does complicate matters. And we most assuredly do not live in France or England, right, or Canada. And so I think there's a natural concern about your information being private, your data being private. And I think this is one of the reasons in many corporate cultures, employee assistance, which is a variation on what Kristen was describing, has such low utilization. I think the idea that it's really airtight private isn't necessarily what everybody believes, even though it happens to be true. I'd be interested in how our other panelists have experienced this. I do think people are self-protective around their work, and the idea of tapping into a great human vulnerability with the even remote chance that the employer might learn about that is not surprising to me that there is a bit of a disconnect.
Yeah, I'd actually like to add some thoughts to that, speaking definitely to COVID and the stress and anxiety that Dr. Duckworth mentioned. We're all experiencing it. And one thing that I have seen from a disability claim management perspective is that we are seeing employers being more empathic and flexible. And especially for those employees that are out on a claim for a behavioral health condition, they're being more accommodating, allowing for gradual return to work, reduced hours, remote work when possible, a change in schedules, going from night shift to day shift. And we're also seeing employers even go a little bit further, because we have employees that might have a really serious condition with anxiety, and now they're told to go to work with masks. So we're seeing employers allowing them to stay home longer, or if they have to come back to the work setting, to really create work areas away from others that allows them not to necessarily have to wear masks. So I think COVID has definitely expanded the space, but employers are definitely more flexible.
It's interesting because it does seem like some of those accommodations are much more obvious and out in the open, and maybe that's the way to begin those conversations then. Adele and Dr. Duckworth mentioned this, depression and anxiety, they seem to go hand in hand, and historically depression has been number one disability. A 2018 Lancet Commission report on mental health indicated that mental disorders are on the rise in every country in the world, and the cost to the global economy is significant, 16 trillion by 2030. The economic cost is largely driven by loss of productivity, with an estimated 12 billion working days lost due to mental illness every year. Your teams are you mentioned your teams are focused on working with employees who are unable to work due to illness or injury, including mental health conditions. Tell us a little bit more about that connection, mental health and disability and recovery.
Yeah, so I'll definitely focus on the piece that has to do with an employee once they are out on a disability claim. And over the years, and still to this day, behavioral health disabling conditions are in the top 5 diagnostic cluster of disabling conditions. So there's definitely opportunity to understand and really work with employees on getting them back to work. And I want to talk about some trends that we see that I think make this all very complex and challenging. So when an employee first decides they want to go out to work, many times they have not been treated for a mental health condition and go see a primary care physician that takes them out of the work. And many times they're treated by that primary care physician without a referral to a specialty provider. And we would like to see that if they're going to be out of work for a significant amount of time, that they be referred to psychiatry or psychotherapy for counseling. Then we see patients drive the disability event. They're the ones who will ask to be taken out of work just because of stress, but we know that to really meet the criteria for disability, there has to be some level of functional impairment at the cognitive, behavior, or emotional level that shows this person can't do their job. And many times it's juxtaposed with a physician who doesn't even know what this employee does for a living. They don't know the requirements of the job. They don't know the level of cognition that is needed. So it's very important that we weave through this and help employees and physicians create a strategy when that employee is out of work. There's usually complications with medications. There's not, one easy pill that works for everybody. The return to work issues are complex. And I would say, I think one of the biggest obstacles we need that we work with is the fact there's lack of objective information. So when somebody goes out for a health condition, there's MRIs, there's lab work, there's x-rays that point to the impairment or the disease. And this is more of a self-report, right? It's how the employee or that patient expresses their level of distress in the psychological realm. So it's important that we really have the right strategies and claim management practices for helping an employee overcome these challenges. So our job really is to educate and level set expectations with the employees and the treating physicians, especially as it relates to the plan criteria. We want to encourage treating physicians to refer patients to specialty providers. We look to discuss treatment gaps and quality of care concerns. And ultimately, our goal is to bring the employee back to work and helping negotiate effective return to work plans. I think most importantly, carriers have a responsibility also for partnering with customers. So when we're managing a block of claims, we have the ability to see patterns and trends around a customer's employee's mental health claim experience. So it's called upon us to collaborate and consult with these employers on how they can potentially use trainings, interventions, and resources to overcome the employee's concerns like stress related at work or potentially high incidence of substance abuse.
Very interesting. Kristen, our research revealed that employees have privacy concerns, and I think we just mentioned it earlier about that unwillingness to engage in conversation. They have privacy concerns about sharing mental health information with their company, and so then many are reluctant to even take advantage of services that are available to them, like those that you've described. As director of benefits, obviously privacy is a priority. How can business leaders balance the privacy imperatives with the administration of those programs that support mental health and wellness?
Yeah, I think that's a really fair question, Mary. And I might have a contrary opinion to that based on our experience here. In some context, privacy has always been an issue in the medical healthcare space, right? Whether that was physical or mental health. Does Big Brother or your employer know what's going on? But I've really found over time that people or employees generally stay with employers who satisfy their need for balance outside of work. And wellness is a key advantage about how we fiercely protect our culture and bring that balance to them. I've also found it to be generational in some context, right? So I referenced, we've got the Gen Z to the baby boomers, if you will. The Gen Z, their entire life is on their phone, and they share everything. They share everything I wouldn't share. But that's where then what am I doing to bring mental health care to them in a modality that they have comfort in? Because perhaps a traditional brick and mortar setting of sharing their private thoughts and information is not best suited for them. So do you look at something like digital, things like Talkspace, Ginger, right, Lyra, that are equally effective, but maybe best suited for the needs while still providing that comfort, if you will, for a different generation of tradition that's followed and respected. I found that the more we speak about mental health, not as a negative, frankly, I just don't use the word stigma tied to it. I see all the studies, I recognize them, I agree with them. I think an approach, though, from an employer view to go about mental health as, let me speak to you about mental health as a stigma, let's eradicate a stigma, is probably not the best first step to take. I think it's more about the progression of, you matter to me, and if you matter to me as an employee, you matter to me as a person. And because you matter, these are the services we're engaging with. And of course, utmost is your privacy and protecting that. And so we've crafted spaces or opportunities to have you embrace taking care of yourself, your full self, while still balancing your privacy. And I think that resonates better in our JetBlue population. Now, also keeping in mind that I don't have access to every individual. I can see someone in the chat is asking about the Google Blue Dot program, and that's more of a peer-to-peer network, right? That speaks to their culture and how comfortable they are in engaging in the topic. Here at JetBlue, we call them wellness champions, and they are individual crew members by day, superheroes by night. I like to think of that they have a passion or an impactful story that it might be hard to share it, if you will, but because it's been a challenge for their family, they want to make sure another family is taken care of.
Yeah, I want to make a quick comment about peers. Sometimes the best teachers are people who have lived experience successfully.
Definitely.
And, you know, that may be less true per square inch in commercial insurance than in Medicaid. But in Medicaid payment, and I think it's now up to 38 states, not quite right about that exact number. You know, peers who have lived experience of, say, successfully managing their own bipolar disorder often offer a different or more personalized perspective. In the early psychosis movement, the peers are often the drivers for engaging people in care. So I just want to say that I think the idea that you can learn from professionals, you can learn from your colleagues, and you can also learn from people who've been there before. And that's a central NAMI construct.
Yeah, and frankly, from an employer perspective, if I jump in there, Ken, NAMI has a fantastic program. It's called Mental Health First Aid, right? So that's how, as an employer, you can bring what I would equate it to as a version of CPR, if you will, for mental health to your leaders. Because typically it's your leaders who are that first line of defense, if you will, as an employer, and they're the first line of receptivity because they do have the relationship with the employee, that they start to share what's concerning to them and how they're not sure how to access help or how to receive it. And your leader has multiple hats on and they're not sure where to go. Something like Mental Health First Aid instructs them on those first steps and to connect them to the right resources and to continue the dialogue together. So it's just part of your common everyday language.
Thanks, Kristen. Another program that we have is In Our Own Voice. And many employers can just request this from their local NAMI chapters. These are people who speak to their first person experience of having a mental health vulnerability, their recovery journey, and then they take questions. So we have a number of educational programs if you want to check out our website, NAMI.org.
Dr. Joe, that's excellent. It actually is perfect in relation to the next slide that we had queued up based on our survey. And Kristen, to your point, we found that a lot of employees get the majority of their information from their direct line manager. And if they're not comfortable reaching out to that individual to talk about mental health support, we're losing a big opportunity. So what's more specifically can we do to help that chain of information strengthen and open up for those important mental health discussions?
Mary, are you asking me?
Sure. Let's start with you. We can ask everyone.
This is often a challenging conversation for managers, right? And I encourage employees to read their culture, right? In some cultures, it may be best just to get help, but actually do get the help, right? Don't avoid getting the help because you may or may not feel safe having a discussion. Of course, my colleagues on the panel are much more well-versed in the whole idea of asking for accommodations, the idea of, here's the thing, here's what I need to do this job. You still have to be able to do the job. But for example, if you had bipolar disorder, certain schedules might be disadvantageous for you, as an example. And that's an accommodation you can ask for. So I don't think it's universal that all managers are ready to have this conversation. That's a training culture conversation. But I think, you still can get help, even if you feel the need to keep things private. But part of the reason you're getting help is so that you can do the work. That's what the manager is primarily interested in, is your ability to perform your job.
Yeah, and if I can add to that, I think it's also important that, we have an opportunity where managers now can proactively engage with employees, not waiting necessarily for the employee to reach out and ask for support. And I think we've been seeing this more than ever during COVID. So as Ken mentioned earlier, everybody has some level of anxiety going through this pandemic. So let's just assume everybody is dealing with anxiety. I think a proactive approach, whether an employee is on disability, and we're talking about a disability claimant or a manager's direct employee, just to reach out, ask questions about their overall well-being. And I know that when we have seen employees out on claims, they actually say they have improved recovery when their manager checks in on them during the absence, because it makes them feel valued, that somebody's concerned about them even while they're out of work. But I do think there is this ability to create a shift where managers, again, if we train them right, if we help lessen their anxieties around the conversation, to have more proactive engagement and touch points with employees.
Yeah, I would agree. And Mary, if I might add on to that, I think there's other opportunities than traditional ways for an employer to address mental health. So a clear example for us, right? We're an airline that requires pilots. Pilots traditionally come up, most part, from a military background. Their whole life is flying, and they have to have clear medical exams every year in order to continue to keep their license to fly. They're probably my work group that is most hesitant to use mental health. So what's another way you can go about it? They also have sleep challenges, insomnia. It's part of their job. Well, that's a part of mental health. So if I can engage with them on a topic like better sleep patterns, then what they don't realize is I'm improving their mental health and still caring and supporting and making it comfortable for them to engage.
It's fascinating. That's a great example too. Thank you. Kristen, you had mentioned something about using sort of digital tools for the Gen Z, their willingness to share. And it's seeming a little bit less a concern about privacy, willingness to share, but you had to do it in the right form. One thing that we noticed that was striking and actually very troubling to me was the study results suggesting that while all workers are, we're seeing an increase in anxiety and depression sort of across the board, it seemed like it was particularly hitting the younger group, the millennials and the Gen Zers, seeming to have a greater amounts of anxiety and depression compared to, for instance, the boomers. Mm-hmm. I'd love to get, Kristen, your impression, your perspective on that, what you're seeing in terms of just the different age categories, and Dr. Duckworth, you as well, and just in terms of the trends generally during this pandemic.
Yeah, I think that your research is spot on. And for us, I can say internally, our own population and demographics, we saw a huge need for the age demographic of 13 to 26. And historically, mental health care hasn't been built outside of a brick and mortar setting to address that in a way that they felt comfortable and confident. Add on COVID, add on school changes, add on social unrest. For us, we saw an uptick. We're traditionally hovering right around a 20% EAP usage, which in the transportation industry, it's typically at about 8%. Q1, Q2, we saw a 51% year-over-year increase, right? Due to all of this unrest going on in the population, but particularly that teen population, if you will, the opportunity to find something that was relatable. So we started looking in the digital market space to see if we could get that intake. For us, we ended up using Talkspace because they were able to deliver that modality to a younger generation. It started at age 13 and up. That was an imperative to us. We are seeing that on their depression scores, if they initially were in the severe and moderate depression, that over a 60-day time frame, they are moving down one level to a moderate or mild depression, if you're using the chart. But we also saw that it was accessible for their family. So they might not all live in under the same roof, right? Families are diverse. I kind of call mine my tribe, if you will, nowadays. And the ability to bring a family together for a counseling session using digital tools, even if you were in different coasts, even if you were in different time zones, that's resonated with our constituents or our employees and their families quite a bit.
Excellent. Thank you. Dr. Duckworth, just trend-wise generally, is this, you seeing this across?
I look at this through a developmental lens, right? When you're a teen and young adult, you have to figure out your identity. Are you lovable? What kind of people do you want in your life? You have to work out a career development. Who am I on a work professional scheme? All of these things have been distorted during the pandemic. But what is also important is pre-pandemic, this generation was reporting more anxiety and more depression than other cohorts. And I think that it's important to remember that there are other pieces to the equation, like the climate changes that we're seeing and the culture within young adults and teens. This is the flip side of what Kristen referred to. They're healthier in terms of being willing to talk about this. I don't think that's driving why they have more, but I do think it's hopeful as a subtext. I think boomers, who are at much higher risk of bad outcomes from COVID than young adults or teenagers, have their life more or less set, right? Their career is more or less set. They may be disrupted through this. They may have lost their job, but they know who they are and they know who they're trying to love and they know what they're trying to accomplish. So their developmental stage in life, while everything is distorted, they've accomplished those key life stages. So that's how I think about it.
Yeah, and Mary, if I may add, I know at the Hartford, we're also seeing, as I talked before in our book, behavioral health conditions are in the top 5 disabling conditions. But when we're looking at individuals in their 20s, it's in the top 3. And I can't agree more. And especially with COVID and the loss of social connections that these generations were used to is really creating an element that we have to really address and look at in innovative ways, because this is the next generation of workers that we need to support. So I think this is prime for interventions and continued studies.
Thank you all three for that. I guess when we think of the younger crowd, their openness, their social media, their lack of privacy concerns or less is probably an asset in taking advantage of support that's available, and that is a good segue to employee assistance programs generally, EAPs. Kristen, we talked about some of the things that you have built and have deployed at JetBlue, and it sounds wonderful. The Hartford's study found that half of employers offer an EAP today. Of those companies who currently don't, many of them, I think 56% or so, are thinking about it for the future. The larger organizations were more likely to offer mental health services in the future. Small business owners, least likely to offer. With you've helped launch mental health engagement at JetBlue. What would you say to those companies that are thinking about it right now, sort of on the fence, or trying to decide what types of programs will give them able to deliver the greatest amount of value?
Mm-hmm. That's a fair question. And can I just segue and say, Fred, who's participating, he's got great commentary in the chat room. I feel like we could be best friends outside of this. So good to meet you, Fred. But I think there's several things an employer can do. I think give yourself a break. Embrace the data. It might be scary. You're a benefits person. You're an employer of choice. Data is your friend. And take those first steps. You don't have to solve it all at once. I would say engage with an expert in this, whether that's your broker, whether that's a mental health expert affiliated with your broker or consultant, whether it's someone like the Hartford, right, as your business partner that has taken a progressive step in this topic, and get yourself educated. I think things like NAMI are incredible resources for someone who might be scared of this topic as an employer, and how they can go and embrace it. And then I would say be kind to you. You have to make it relatable. You have to make it everyday common language. Just like you talk with your kids at the dinner table about their schedules and their after-school activities, you need to talk about mental health in the workplace with that same simplicity. And those first steps, right? Data, engaging with your broker or consultant or your version of a mental health expert, finding some quality resources like Anami, and then once you decide which aspect you're going to deal with first, based off of your data or based off of your employment or based off of your culture, make sure that what you go for resonates with that culture. COVID taught us quite a handful of lessons, and we had to pivot quickly. More so than we ever have on this topic. I'm stealing our party line. We created a campaign tagline of "Be kind to you," and we started advertising our EAP services on a weekly basis. But then we also went into new spaces for us: mindfulness, Calm app, things like that. That there are free services. It does not cost you a lot to start, and there are people in the expert space of the mental health continuum that are willing to have you engage in utilizing their services on a small or reduced effort. That might be the right first step if you're a small employer, or banding together with all other small employers to take advantage of price points and opportunities together.
Great points. Thank you, Kristen. A recent opinion piece published in Fortune magazine actually highlighted our Hartford chairman and CEO, Chris Swift, as he discussed breaking down, we use the word stigma associated with addiction. And I think when we say stigma, it's the inappropriate shame. It shouldn't be there, but some people feel that way, and prevent people from talking about it and being able to tackle the issue. We've talked today a lot about the research showing that mental health conditions probably are in that same place in terms of there being some sort of stigma or shame associated with them that prevent people from being able to openly discuss it and feel comfortable talking about it. Dr. Duckworth, is it important not only to offer mental health services and benefits, but also to provide some training on how to create that better environment so that people feel comfortable talking about it?
I think that's right. Yeah, I think of this area as shame, which is the internal experience, prejudice, which is the perception from other people, real or imagined, and discrimination, which is why we needed things like the mental health parity law and for attorneys general across America to make sure that, in fact, there is equivalence in the approach. So I think it's all of a piece. I do think you can also say another truth is that more people are seeking help than ever, both for addiction care and for mental health care. Every single practitioner that I know is working at 110% of capacity, right? They've never been busier. And I appreciate that this pandemic has impacted different people in different ways. For people with a mental health license, they are absolutely as busy as they could be, usually through teletherapy or phone sessions. Phone sessions remain an important vehicle, and NAMI's advocating for this in the post-emergency world because some people don't have adequate internet and some people don't have enough privacy to talk to a clinician without the phone. So I think it's important. I do think in the addiction space, leadership is also important in this because we still have a culture that has a moral subtext as opposed to viewing this through a biological process. So the idea of clean and dirty urines is a classic example of terminology we don't want to use because that implies moral behavior. It's a condition of variation on diabetes. It's biologically driven, and your behavior can make your blood sugar worse. It's just like diabetes, which is a biological construct. So we have to also move away from this kind of moral code, particularly around addiction.
If I may, I just want to say, I think Kristen and Ken really provided some great insights here. And for me personally, I think the languaging has to change and what we call this. When people hear psychiatric illness or mental illness, then they want to hide their symptoms because they're afraid to be labeled as such. And I think if we can go to a place of talking more about overall well-being, and I definitely think COVID has done that, then people are more comfortable talking about it. I think seeking the needed care and everything right now with telehealth and the digital apps, I think are also normalizing people because they're seeing they're not the only ones. And especially as people blog or they see how many people review the apps or how many people align with a condition, they're able to say it's not just me.
Adele, it's almost like you read my mind. That was sort of the last question I wanted to ask all of our panelists. Really thinking about, in light of the pandemic and, all that we are feeling, do you think discussing mental health topics in the workplace will be a little bit easier because of what we've gone through? Does it give you hope?
Absolutely. This is one of the greatest opportunities for culture change and empathy we've ever seen. That 41% of Americans are reporting clinically significant anxiety, depression, trauma, or addiction relapse in a CDC study of more than 6,000 people from August, right? I mean, this is a remarkable data set if you want to evaluate it. If that's not an opportunity for empathy and breaking down this idea of the other has a problem, I am okay, this has become a universal set of stressors, and we're all dealing with variations on uncertainty.
I wholeheartedly agree with Ken. I think that this is a keen opportunity. It gives me much hope. It was very interesting from an employer perspective of all the varied resources we already had pre-COVID. Those we suddenly ramped up in the midst of it. We intend to retain most of those going forward. But what spoke to me more directly was I received a note from one of our crew members, and her commentary was it was her genuine feeling that if more of us had access to these mental health resources, that we'd create a better work environment and a better JetBlue as a whole. And I carry that in my heart every day when I'm working on this topic, because we are going to make that a reality here for us. But I strongly encourage every employer to take the first step.
And I just say ditto. I mean, really, this has been the blessing, right, through this pandemic, the ability to think about ourselves as human beings differently and to incorporate that sense of well-being in the workplace. I think employees are more engaged and employers more understanding that these employees have children they have to worry about, how they're going to take care of them while they're, trying to be educated virtually or going back to school with masks and social distancing. So I think we really have a higher level of empathy. We can learn from this, expand on it, and enhance offerings that we have. And if we happen to be a smaller employer without those rich resources, there's so many resources that we can point them to, resources through NAMI, other areas to make sure people are connected to crisis hotlines, and just anything that might be needed in the space.
Mm-hmm. And Mary, if I can just add, I also think it takes us forward into what's now going to be health equity, right? So just as DEI has become the forefront of a lot of the dialogues with the social injustice, how does that resonate into our own space? And do you start to, after you've embraced wellness on all aspects, do you then start to look at some of your population and how you can pivot or triage to different personalized nuances for them that bring health equity or parity within it? And that, the benefit geek in me is very excited for that in the future.
That's very hopeful. Great. Thank you, Kristen. We have a couple of minutes. One question that's come in, and I think it's as much tactical as it is anything, and it's work related, but it's just life related too. But how do we support our employees and our friends and family members during the holiday, the upcoming holiday seasons? As we know, sometimes it's harder on individuals that are struggling with mental health conditions. Any tips or things that we ought to all be thinking about doing?
I run a mental health chat every week for Blue Cross employees. And one of the things I say every week is, this is my first pandemic. But I've never attended a pandemic mental health course. And I attend the American Psychiatric Association meeting every year. I suspect next year there will be dozens of courses on pandemic mental health. What I do in the chat function is I encourage our employees to teach each other best ideas, best ways to approach it. Somebody invented a catapult for Halloween, which they displayed, that you can launch candy from the front of your house into children's waiting pillowcases, right? Again, some of this is classic mental health, right? Duly noted. Mm-hmm. Some of this is human creativity, finding ways to stay connected and to fight isolation in the context of a life-threatening illness that we're all trying to avoid the spread of for many reasons. So I think the idea of having I'm going to encourage you to consider having your employees teach each other. I always try to disabuse people the idea that I know everything because I'm a child and adolescent psychiatrist. Well, I know a lot about how to help somebody with OCD overcome that. But in terms of how you manage Halloween, I never thought of the candy catapult. And that, is good for the employees in so many ways, right? Because I encourage the idea that we're all at our first pandemic. What could we learn from each other? And I think that's a relatively hopeful and empowering message.
Thank you.
So, Mary, I think, just to reiterate, Like we saw this summer, when trips were canceled, vacations were canceled, graduations were canceled. So the holidays bring in that same level of stress. And I do think employers have an opportunity to continue to create strategies to support employees and keep them connected through things that can be done virtually, like having virtual happy hours, book clubs, wearing your worst ugly holiday sweater contest, sharing articles, blogs. I think keeping people connected is going to be critical through the holidays, and I think that's one way they can still do it.
Thanks, Adele. Okay, well, I see we are close to wrap-up time. I don't want to let a lot of folks go without a few comments and a couple of thank yous. So to recap what we discussed and what we covered today, I think it's undeniable that mental health is an important part of the workplace. It's a critical issue that we face now more than ever because of the pandemic. While the survey research indicated that there is a divide between employers and employees in terms of that mental health support and the ability to get that support. We talked about some ways to help bridge that gap, including education about mental health conditions, using respectful language, and taking advantage of resources like NAMI. And of course, employers can offer supportive services and training for managers to help deal with employees to help them find support. So you can find more information about our partner NAMI at www.nami.org. Our customer JetBlue offers flights to over 90 destinations, and you can access that information at jetblue.com. And of course, you can visit thehartford.com for more information about this research, as well as our group benefits and workers' compensation offerings. So I want to thank our panelists so much for this past wonderful hour. Lots of great information, and so much appreciate your heartfelt comments and your enthusiasm. And then also thank you to all of those that joined us today.